So this is the last slide for today. Just I will briefly go through the structures which are passing through the openings that we just saw in the inferior aspect of the skull. So there is this is the point, this is the part that you have to memorize with all your energy. There is a lot of MCQs, there is a lot of exam questions asking, okay, this is the opening, which structures are passing through it. Let's go through them one by one. So this was the incisive canal, incisive fossa. The artery and vein have different name here. The artery which passes through it, it's the nasopalatine, sphenopalatine vessel. You will see two names right here. Sorry, you will see two names right here. You will, in different books you will read sphenopalatine, and in few books you will read greater palatine. I think mm, um, let's see. Okay, you will see greater palatine also. Why it's written like this in this? Because greater palatine artery is the one that comes from here and it comes inside here, goes inside, and from the nasal aspect the sphenopalatine vessel is coming downwards. The both of these anastomose right here. So in different books you may get, in addition to greater palatine you may get, in addition to sphenopalatine you may get the heading of greater palatine also. So don't be worried, it is because these two are fusing right here. The nerve that is passing through it, it's totally different name, that is known as sphenopalatine, that is known as nasopalatine. The artery is sphenopalatine, the vein is nasopalatine. Then there is greater and lesser palatine foramina, and both have the same names. There is a greater and palatine, the structures containing have the same name, greater palatine nerve artery vein, lesser palatine nerve artery vein. Then there is known as greater petrosal nerve or foramen lesserum. Foramen lesserum is a very tricky topic. Um, I always say that don't want to go into the detail, but I do go into the detail. So here I go. Let me give you a little background. Foramen lesserum is like this. This is the bone here. Here is the bone right here. It is the opening for the, okay. This is the foramen lesserum. The foramen lesserum. Actually, what happens is that here in the petrous bone, there is an opening for the carotid artery. Carotid artery comes from here, moves through the carotid canal, curves right here and move up. So here the carotid artery just bends up just on the top of the foramen lacerum. So technically speaking, it is not passing through the foramen lacerum, but because it's of its close proximity with the foramen lacerum, Snell and some other books do mention that it is a content of it. It is not technically very true. Also, the lesser petrosal nerve, here about here there is a pterygopalatine fossa right here. There is a pterygopalatine fossa. So there is a palatine bone in front of it. So the nerve, it also passes through here and it goes through a canal to this point. So this is lesser petrosal nerve. No, this is not lesser petrosal nerve. This is sorry, the nerve that is passing lesser petrosal nerve. I will discuss it more with the cranial nerves exact is pathway. I think I have not done justice with it. So technically speaking, these structures are not passing through the foramen lacerum. This is the thing you must remember. These are passing just above it. So in Snell and in Netter, you may get a different options, and that's the reason. Greater petrosal nerve is written here. I said lesser petrosal nerve, but it is greater petrosal nerve. It passes just on the top of it. Internal carotid artery passes just on the top of it. You see, foramen lacerum does not have written greater internal carotid artery, and here foramen lacerum internal carotid artery is not written. It is written here. So if given the option which internal carotid artery passes through carotid canal would also always be the better answer. So which other structures are passing? Foramen lacerum we have spent so much time on. Foramen ovale contains the mandibular division of the trigeminal nerve. In addition to it, lesser petrosal nerve passes here and the accessory branch of the middle meningeal artery. Accessory middle meningeal artery. Then there is foramen spinosum, middle meningeal artery. Everything related to middle meningeal artery is very important in the exams. It passes through which opening, and it passes through Tyrion and all the story of the breakage. And then there is an opening of the carotid canal, carotid opening, carotid artery passes through it along with the sympathetic plexus that is surrounding its wall. Just behind the carotid canal, there is the tympanic canaliculus, the tympanic branch of the glossopharyngeal nerve. Inshallah, we will discuss in the cranial nerve portion. Passes, exits here. Then there is a mastoid canaliculus and stylomastoid foramen. Mastoid canaliculus, um, it has some branches of vagus nerve. If you forget it, don't worry, it is to be forgotten. Petrotympanic fissure, that's an important content that's usually forgotten. That is a coda tympani, the part of the facial nerve that exits the middle ear and supplies the salivary signals and the taste signals to the tongue, and salivary signals to two of the three salivary glands. And then we come to this stylomastoid foramen, the most important facial nerve. Stylomastoid has a very interesting MCQ. The mastoid process, it is usually developed by 2 years of age. So before, in the newborn, when the newborn is being born, the facial nerve, the stylomastoid foramen, it is not covered laterally by the mastoid process. So in newborns, the facial nerve is relatively exposed on the lateral aspect of the skull near the stylomastoid foramen. This becomes very important in the gynecology and obstetric practice because mm, wrongly placed forceps can have a direct pressure on the stylomastoid foramen, then on facial nerve, and leading to the facial nerve palsy. So this is an important MCQ, that stylomastoid foramen, it is guarded by mastoid process, and this guarding starts after 2 years of age, after the mastoid process has developed. Before it is only covered by sternocleidomastoid muscle. Then there is jugular canal, jugular foramen. Jugular foramen contains the jugular vessel, interjugular vein, and the last four cranial nerves. Last cranial nerves, that is glossopharyngeal, vagus, accessory nerves. Then there is hypoglossal canal. In addition to it, it may contain some vessels, veins. Otherwise, it's the hypoglossal canal. This is the mastoid foramen. Mastoid foramen contains the mastoid emissary veins that connects to the sigmoid sinus, and then the foramen magnum. Foramen magnum contains the last part of medulla oblongata. It is actually the transition point between the medulla oblongata and the spinal cord. So both can be seen in the contents: medulla oblongata, lower part; spinal cord, upper parts. And in addition to that, extra structures, you must remember that the arterial system is going up, that is the vertebral arteries. Its branches are coming down, that is anterior and posterior spinal arteries. Venous plexus around the vertebra, that is going around. Meninges, all three layers are going through it. And the nerve that is important, that is crossing it, is the spinal root of the accessory nerve that was arising from C1 to C5, that moves up the foramen magnum to go into the posterior cranial fossa. And then again with the subarachnoid space and the CSF and all those structures. So these are the fissure and the foramina. So this is the skull. We are left with the superior view of the interior of the skull. Foramina in the interior of the skull, I have not discussed in this particular lecture. So before concluding, any question, any query, any suggestion, at least before, any question regarding the base of the skull, I am leaving it at this slide that you want to ask, then we will close. You may mention in the comments. Okay then. Thank you. So the most of the pictures I took is apart from the first one were taken from the Netter's Atlas. You can go ahead and look for yourself. And the atlas I was using, the 3D atlas, it was Complete Anatomy by 3D for Medical by Elsewhere. You can just Google it and you can find the atlas. The bony part is free, and the rest of the soft tissues you can purchase it for a price that will be listed. There are other 3D models available which you can find. Thank you so much for staying with me throughout. I hope so. It was more beneficial than confusing. And do give your feedback. I'm present here. If any question for regarding the today's discussion, do ask me. If any feedback you have, any suggestion for the subsequent lecture, we have 10 lectures in this crash course. If there is a particular way you want this course to be continued, so do tell us here. As far as the interior of the skull is concerned, let me make a recording. I will upload it separately. I have on our page, I have make a separate album that will contain all of these live sessions or the uploaded lectures from this. Thank you so much for listening. Any comments, questions, feedback? Okay then. Thank you so much for being with us. Inshallah, see you in the next lecture. Uh, do let us know in the comments what you think about this and how would you want me to improve over the next lectures. Till then, good luck and Allah Hafiz. Have a happy vacation.